welcome again, everyone, to the fourth annual, I thought it was fourth annual Captain Summit. How many of you are actually new to Captain this year? Raise your hands real quick. Excellent. We got a lot of new members this year. Welcome to you guys. How many of you guys have been coming since the beginning, the very first summit you were here? All right, excellent. Thank you for staying with this. As you guys know, and we'll learn for new members boot camp, the vision of Captain has always been to provide, to establish a statewide interagency collaboration between three major entities: the regional centers, the SELPAs and school districts, and our family support agencies in our state, to really bring together regionally a team of trainers, people who have expertise and knowledge in autism and can help to disseminate information about autism and evidence-based practice at the local level. California is so huge that everything really does come down to our communities and what happens at the local level. When we formed Captain and set out to create this training network, we actually had an opportunity in our state to participate in a 2-year grant with the National Professional Development Center for Autism Spectrum Disorders. And we have as our keynote speaker, who you'll hear from a little bit later on today, Dr. Sam Odom, who was the PI for that project. So in essence, we owe all of this to him and his work, because without the MPDC project, without the tools and resources that were created by the MPDC, this would have never come together in the way that it has. So we're really thrilled that he's here to share some information with you all today. After that 2-year grant cycle, we thought, we need to figure out a way to bring this to scale in our state. We need to figure out a way to be able to get this at the local level. So we set out with 3 goals in mind for Captain. The first one is we want the people involved to really be the transmitters of information about autism and evidence-based practices, and to increase knowledge about autism and EBPs through systematic dissemination. And this summit is a part of that. New members come, they learn about the tools and resources. You guys establish a regional plan for what you're going to do when you go back to further disseminate information at the local level. Goal number 2 of Captain and you all as cadre members is to increase the implementation of those evidence-based practices with fidelity, both in schools and in the community. And our cadre members who are nominated by schools, you know that you have specific goals that you're supposed to accomplish in terms of providing training and also coaching to help teachers and to help classrooms and programs reach fidelity on the important evidence-based practices. But our family support agencies and our regional centers also have a really important role as it relates to this goal. And that's helping families and helping service coordinators and helping providers, vendor providers, adult providers in the community learn about these evidence-based practices and about the training tools and resources that can help them to reach fidelity as they work with their kids and with the consumers they support. And then our third goal is to increase interagency collaboration and to leverage the resources of all of these agencies and all of these important stakeholders to solve local issues and local problems, because every community has its own unique set of challenges and issues to address, and to standardize a process for using EBPs. And I don't know how many of you have been around in special education as long as I have, but I can remember the days of literally day-long IEPs where we didn't ever even get to the goals. It was all about arguing about what is an effective practice and what program that the child would receive. And we really feel like that's been one of the biggest impacts of Captain so far. We're no longer arguing about what evidence-based practices are. We can get down to the work and the business of now deciding as IEP teams and deciding at the local level what practices to use and how to get them happening in an effective way, both in-home and in the community. So each year after the summit, the leadership team gathers and we talk about, well, how did things go? What were the really important messages that We heard from you guys in your regional planning times and throughout the summit. What are your needs based on the survey that you guys complete? And what can we do at the next summit to be able to really bring you something that will increase your skills and increase your leadership even more? And I want to start by saying that this is such an amazing and elite group. You guys have been picked, handpicked, by the leaders of your organizations to be a part of this. And it was no small task for them to identify a person or people from the organization, because we said we want people who are already really experts in what they do. And we don't want to have to train them on what autism is. We don't want to have to train them on what these evidence-based practices are. We want them to already have that foundation of knowledge. We want to bring them together to teach them and work with them and collaborate with them to take what they know and put it in action and establish those networks at the local level. So every single one of you is already a leader, but after last summit, it was one of the themes that kept coming up for us, that the message we got from you guys is we want to know more about how to get this out there, more about how to be a leader, more about how to do really good professional development and really good coaching and influence our administrators and influence our decision makers so that they buy into this and understand what needs to happen as much as we do. So we decided on a theme for this year, leading from where you are. And this is really important because in addition to you all being amazing experts and leaders, some of you may be very silent leaders, maybe influencing people just through one-on-one interactions whenever you get an opportunity. Some of you may have an opportunity to stand at a podium in front of hundreds and get the message out. But no matter what organization you work for, no matter what role you play within that organization, no matter what role you're taking in Captain, you all are leaders and influential in our mission and our vision and our goals. So not long after the summit, after we decided on this theme, I think I was on Facebook or some kind of social media, and I came across this picture, which, why is leadership tied to the backside of horses? You're probably looking at this going, what is this? But it actually linked me to a blog that I thought was really inspirational and that really made me think of the work that we do here in Captain. And I have the link to the blog there for you, but I just want to read a little bit of an excerpt from this. So the horses in this photograph depict a herd of 4 horses. The white horse is Artemis, named after the Greek goddess of the hunt. As you can see, the third horse's ears are turned towards Artemis to listen for any guidance or direction. Artemis, a mare, is the leader of this herd. In horse herds, the leader leads from behind, putting often a single horse, or in this case, multiple horses in front of her. This might seem counterintuitive to the general beliefs about leadership. We often associate a leader or leadership with a position of power or authority, the one that is in the front. However, by observing this herd, could it be possible that we can lead from anywhere? Is this ability to lead what Artemis is displaying in this herd? She's not using positional power or being in front, but empowers the horses to lead and provides guidance from where she is through communication and direction. The horses in front are going where they think they need to go, and Artemis is empowering them to do so. But they will check in with her by turning their ears if there is a need for a change of direction. The ability to lead doesn't come necessarily from a position of power or authority or having a specific title. The power to lead comes by your ability to inspire, empower, and support others in their decisions. And that's really what Captain is about, empowering those people that you work with, the teachers, the parents, the community members, to learn these tools and resources, to learn these practices, and to use them effectively. Everyone can be a leader from where they are, regardless of their role in an organization. Leading is simply taking responsibility for your actions, raising the concerns of others at times when it's necessary, and being an example of others through your actions. as I've said, everyone in this room is a leader. And the information that we heard this morning, there are a lot of issues that we face and challenges and barriers that we know that you guys encounter going out there and trying to accomplish these goals. There are barriers to getting groups together to train them. There are barriers to the time to be able to go into classrooms and do support and to be able to get with service coordinators and give them information. Some of you may even be experiencing barriers in terms of your agency support for the work that you do. And we know a few of you are kind of doing it covertly, which we really appreciate. These barriers are real, they happen, we understand them, and we also understand that at times you may be given more support than others. And one year you may be able to do more in terms of these goals that we have for you, for Captain, than other years. I wanted to, though, take a minute to reflect a little bit on the information that Kathy shared with us, because policy changes are also a significant issue that we face in all of the service and work we do. Policies can change on a dime, and it has a huge ripple effect and can influence the amount of support, who we work for, and all of those things. But I want you guys to recall, those of you that have been here a while, it was just after, I think, our first summit. We had gone out and nominated all of the folks from the regional centers, the autism specialists, to be a part of Captain, and they were really excited to be able to influence the behavioral health treatments and the services for kids with autism. And then the SB 946 happened, and the behavioral health treatment for autism, the funding shifted. It was no longer going to regional centers to pay for vendor services. It was going through Medi-Cal and through the behavioral health providers. And the room full of autism specialists at first were shocked and kind of went, well, how do we fit into Captain now? Like, we don't now have the ability to influence the behavioral health providers. And so what is our role? You guys remember feeling that way? And there was a lot of discussion even amongst our leadership team about, well, how does this significant policy change? How is it going to change our interaction with regional centers and our collaborations in the communities? But the regional center folks, and I want to compliment those of you in Northern California, started meeting, and they started redefining their roles and thinking about the importance of evidence-based practices regardless of whether or not they are the funder of the services. The providers still need to know what they are. The families still need to know what they are. The service coordinators who help the families advocate still need to know what these evidence-based practices are. So rather than working directly with those vendors, which was the original thought, idea, and plan, the shift happened to be able to influence a different group. Not the original intended group, but a very important group of people in the community. And taking on and shifting and rolling with that, to me, is an example of leading from where you are. Because we have no way of really knowing exactly how this is all going to play out. We don't know what's going to be decided in the governor's budget. We don't know if the SELPAs are going to not exist in some different shape, form. We don't know who is going to be helping us to identify and nominate people like you. But I want to share with you our commitment. We commit that no matter what happens with the governor's budget, with the structure of how special education is provided in our state, to continue this work. We're going to figure it out. We're going to figure it out who we need to talk to get you guys nominated, to get you guys here, and to continue the amazing work that you guys have started. That is an absolute commitment that the leaders have made. And we ask in turn that you guys stay in contact with us. If you shift to a different agency, paying your paycheck, if there's anything that does shift, please let us know, because we want to keep all of you doing the work that you've started. And I want to just say one final thing before I wrap up, and that's that no matter where you are, no matter where you find yourself after the May revise or next year's budget, no matter what policy happens, you know the numbers and the impacts and the increases that are going on out there. And you also, every single one of you, know the power of evidence-based practices when we can get them implemented. The need for you, no matter what umbrella you're under, the need for you is doing nothing but increasing. The need for the skills that you guys have, the need for the dissemination of this information, the coaching and support that needs to be given to teachers and parents and educators and providers out in the community is increasing every single day. So you really have nothing to be afraid of, nothing to be nervous about, because the demand for you is going to remain really, really high. So think about leading from where you are. As you go through this summit, everyone can be a leader regardless of their role in an organization. Leading means taking responsibility, raising concerns and awareness when you need to, and being an example to others. And the ability to lead doesn't come from a title, a label, or a position within an organization. It really comes from your ability to teach and influence and empower and support others in their decisions and in providing them with your knowledge and guidance whenever you can. Sometimes that means managing up and doing some really important work with the administrators and your school boards and your CACs and people that are in those positions of power. And managing up is an important concept for you guys to think about. And we actually added a requirement this year that you would all go back after the summit and share your regional plan with your administrators, because they need to know what the plans are and why this is important. And if you're not going back and having conversations with them, how can you expect them to support you? So ask yourselves as we go through this summit and as you participate in the next 2 days, how can each of you lead from where you are? And of course, I couldn't put a picture of horses up without putting up a picture of Temple Grandin, and I think a quote that it really speaks to the work that we do. So with that, what do we have planned for you guys the next couple of days? Well, this is not a conference. Conferences are different than summits. A conference, you go, you attend sessions, you learn new information, and hopefully you take it back and do something with it. A summit is a bit different. This is an opportunity, yes, for you guys to hear some new information, to build your skills, but more than that, it's an opportunity to have a strategic conversation about the information that you're hearing and learning, to be able to then develop a strategic plan for your communities. So content, yes, you will go to workshops, you will go to breakout sessions, you're going to learn a lot of new things, hopefully over these next couple days, but it will culminate in the regional planning time tomorrow afternoon, where you're going to get together with the people from your region, regional centers, schools, family support agency providers, and you're going to say, well, now what's our next step? What's our next step for disseminating this information, for helping our providers and teachers implement evidence-based practices, for managing up, and if we need to, meeting more with the administrators in our organizations to help them along to the point that they can give you and provide you with more support. So sharing is important. You can't just sit back and receive. You have to communicate, you have to talk, you have to share your opinions, and really let people know and understand your position and your ability to influence and do certain things. That's a really important part of a summit.